Good morning. So today I wanted to talk a little bit about COVID and how we can all really stamp out the virus in the community, in the substance abuse community. Here we are in the middle of January 2021. It's an evolving problem. It's almost been a year since we first started being affected by this thing, and things keep changing. And we're at peak sort of numbers now. Things have gotten worse, and it's particularly bad in the substance abuse community. A good friend of mine actually runs a couple of halfway houses and was just in the hospital and almost died from liver failure. Young, healthy guy. We've heard stories of it going through halfway houses and in the community, death rates are at a high, and we need to just keep working on it. The good news, of course, is that the vaccine is here and is very good. And so the big thing I wanted to talk about today is whether you should get the vaccine, because there's still a lot of people who think that maybe it's dangerous. In the meanwhile, everybody needs to keep doing what we already know works, which is staying more than 6 feet away, the social distancing, and wearing the masks. So even though our office is frontline healthcare workers and we've been able to get the vaccine, we're still wearing masks, except for when I'm doing this video. We're still being safe. But I wanted to talk a little bit about the vaccine because the good news is it's incredibly effective. I was just reading something this morning that says that we've actually been underselling it. We haven't been telling everybody just how effective it is, because the truth is, out of the 32,000 people who got the vaccine in the trials, only one person got a serious case, and nobody's been hospitalized or died from it, whereas the placebo group and the people who haven't been vaccinated, the statistics are bad. So people are worried about getting the vaccine, that there's been a couple of worries, that it's too new, that it's been rushed through. The truth is, it hasn't been rushed through. It's gone through all the stages of the FDA. And the good news is that the drug companies that were working on this actually started working on the technology for this using messenger RNA for the last 5 or 6 years, and they had really gotten the methodology and the techniques and looked into the safety of it well before this happened. So as soon as the COVID or the coronavirus became known, they could isolate it, the genetics of it, very quickly, and within a couple of days they were able to figure out how to produce a vaccine that was very safe. So it's been gone through all of the regular procedures. And I wanted to talk a little bit about how it works and why that it makes it obvious that it's safe. So it turns out that the vaccine is a messenger RNA vaccine. And so some people are worried that it's putting DNA and changing a genetic code, and it's just not true. The way the virus works is it comes into a cell and it has RNA in it, or ribonucleic acid. This is not DNA, which is found in the cell nucleus. It's the RNA is found in the rest of the cell. And so when the virus attacks you, it injects its RNA into the cell, and it then convinces your body to make lots and lots of itself and lots of its own particles. So one virus going into a cell can probably make millions of copies of itself, and then obviously that creates a huge infection because it's exploding and multiplying so quickly. What the vaccine does is take a little snippet of the RNA and put that into your cells, so that then it convinces your body to make just the little spike protein. And the spike protein is what your immune system recognizes as foreign and starts making antibodies, both the B cells and the T cells. So it both kills the virus very quickly when it comes across it, but it also creates memory cells that will respond to the virus in the future. So there's no way that RNA can get into the cell. There is no pathway for RNA to be turned into DNA. It's just is doing exactly what the virus is doing, but instead of making copies of the whole virus that can infect you, it's just making copies of the tiny little spike protein, which is what your immune system needs to be able to recognize it and defeat it. So it's incredibly safe. I certainly got the vaccine. I ran to get the vaccine. As soon as I knew that we were available, I was signed up the next day, and most of our staff have been already vaccinated. So we feel so much safer now and are able to start seeing patients in the office and actually helping to treat people so that we can help them with their addiction. it just is what we all need to do. So please get the message out that it's very safe, it's incredibly effective, and the more people that can get the vaccine, the better. The truth is, you need to be a bit of a squeaky wheel, so we did not get contacted by anybody in order to get the vaccine for our office. So it was us that had to reach out to the Department of Health and see if we were eligible, which of course we were, because the substance abuse community is being affected so badly by this disease. There's so many more overdoses and even suicides and more depression and things like that. So it's important that that people reach out and find out if they're, when they're eligible for the vaccine, and then take the initiative to get vaccinated. So please tell your friends and family that the vaccine's safe, and try to get it as soon as you can. But in the meanwhile, let's do all the other things that we know work to keep the vaccine from spreading in the community. Wearing your mask, staying socially distant, and being sensible. The big spreader events are ones where people are in contact with breathing and with coughing and particles that come out of the lungs over a protracted period of time. So restaurants continue to be somewhat dangerous. Big events where you're in close proximity to people for long periods of time are dangerous, and we need to all do what we can. Thank you.